guys, and welcome back to another episode of Next to Madison. We have got a new year. I am so excited about this. Sitting next to me today is a board-certified gynecologist and is also the author of Menopause Confidential, Dr. Tara Allmen. Welcome to the show. How are you?
Hooray! I'm so happy to be here.
I'm so excited, and people probably are thinking right now, like, why is she talking about menopause? Like, she's not old enough yet for menopause. But I think it's important that we all know what's coming, you know, and that men know what's coming for their partners and for their friends.
Well, for all your listeners, everybody for sure over the age of 40, both men and women need a lecture on what I consider what to expect when you're not expecting, right? We don't get a lecture on this topic,
Yes.
perimenopause and menopause. So buckle up. We're getting it now.
Okay, so let's kind of start from the beginning. So a woman has, and guys, stick with us here. A woman has her period, because men are always like, around 11, 12, 13, right? Can you kind of walk us through a little bit what happens in the body up until we hit that point?
Well, let's get started with younger women. So when we first get our menstrual cycles, what that really means is that our ovaries have gotten to work, and their job is to make estrogen, progesterone, testosterone. Have I lost everybody yet?
Yeah.
But most importantly, their job is to ovulate an egg every month in order to get pregnant. And if that doesn't work out, then we have a menstrual cycle, we have a period. That periods, interestingly, are considered pregnancy failures. But guess what? We try again every month. The brain has a chat with the ovaries every month and gets us ready to try to get pregnant. If that doesn't work out, we try again every month. That journey, that process starts in adolescence, and it takes us usually all the way into our 40s and early 50s.
Okay.
At that point, our ovaries retire from that job. I'd like to say we should thank our ovaries for their excellent service, but at some point they get to retire, and that's menopause.
Do you know what's so funny is I remember I was talking to my therapist and I said, I get so sad around my period and PMS, and she said to me, well, think about it. Your body was expecting and preparing for a baby, and it didn't get it. So your body's kind of going through this mourning of just getting rid of the lining that was supposed to hold. And I thought that's a really good way to think about it.
That is very interesting. And I say to all women who haven't had children, you can have mine.
I know, because there was a couple episodes back, I actually recently had my eggs frozen. And I talked to the doctor who did that. So we did a whole thing about kind of fertility and how we lose our eggs so quickly. And by the time we're actually ready for a baby, we're almost depleted.
Well, that's a very interesting point. So we just get so many eggs at birth, and by the time we start ovulating, we're even down to very few. We've got, about 30, 40 years of ovulating, and that's it, sister. And then we run out of eggs. And now, here's a really important point for your listeners. Women will spend about 30 or 40 years in menopause, which means they've run out of eggs and they're going to keep living onward. So if the average age of menopause is 51 and women are living until their middle 80s, we're going to spend a third of our lives not making estrogen, not making testosterone, not making progesterone. And these things have really important consequences for women.
Right. So something personal about me is before I was diagnosed with a thyroid condition, I went and got all these tests because I couldn't figure out what was going on with me. And they said I had a very low level of progesterone. I didn't know what the heck that meant. Everything kind of leveled out. But can you talk about those specific hormones and kind of the roles that they play in the body? Because when she says you have a low level of progesterone, what the?
Well, I think of estrogen as women are made of sugar and spice and everything nice, and that everything nice is estrogen. So I want everyone to know estrogen has many jobs to do, and it's got to do it well. From hair to toenail, all over the place, estrogen is working for us, making everything healthy, wealthy, and wise. Progesterone really has one job in the in the pregnancy realm, it really has to help fluff up the uterus for a pregnancy to arrive.
Okay.
And so when we ovulate our egg, at that point, progesterone really kicks in, and that's when many women experience PMS symptoms. It's in the second half of your cycle, right before you have a menstrual period. You're pretty high in progesterone, and that's when we feel very PMS-y. Progesterone levels are important when you want to also be a pregnant person. You need progesterone to help sustain that pregnancy, and so sometimes women have issues with infertility or
Yes.
pregnancy loss.
Okay.
And they don't even know about it until we start measuring progesterone levels and find out that was an issue for them.
Right. Okay. So if somebody is experiencing some of these low-level hormones, like what are some steps they can take?
I don't want your listeners to focus on getting blood tests and worrying about
Okay.
issues. If you want to be a pregnant person, the only way to get to be a pregnant person is go out and try to get pregnant. So you have to
sex.
You have to test the system, right?
Don't pull out. Right?
Was that part of our talk today? Are we talking about perimenopause and menopause? But yes.
Yes.
We're gonna move on to the part after our reproductive needs have all been met, and we're on to the next phase of our life. But
Right.
for the younger listeners, when you're ready to be a pregnant person, go try and be a pregnant person. And if you're having some issues, then you can talk to your OBGYN about what testing to be done. But don't spend too much time worrying about it.
Okay.
Spend a lot less time about that and start having sex, just like you said.
Yeah. Do you know what's funny is all my friends, not a lot of my friends had to go through IVF at all. They said, we just went on vacation and got knocked up. And I think it's when you stop thinking about it and stop stressing about it that it really starts to happen.
That's right. You have to have time, and you have to be just right in your cycle, and you have to get busy, basically.
So before we go into the menopause thing, I want to talk really quickly about these ovulation apps. They are very popular. You can go on with your phone and get them. I was using one called Pink Pad, and you were able to track your period, and it would give you like the money shot day. What do you think about those?
Well, I don't know. Maybe it's generational, but I'm 55 and menopausal, and I never have used an app for that.
Okay.
But it's so easy to know around when your ovulation is the old-fashioned way. Get your paper and pencil out. If your cycle is 28 days, let's say, subtract 14 days from 28 days, and you ovulated day 14. So if you want to get pregnant, you want to have sex a day or two before day 14 and maybe one day after because the egg floats around. If your cycle is 30 days, subtract 14 from that, and that's when you ovulate. So just get your paper and pencil out. You can do math.
You know what my one friend did? She took her temperature.
Yes, basal body temperature is another way for women to do it, but it's really time-consuming, and it's not as accurate, and it'll make you just crazy.
Okay, gotcha. Well, that's good to know. All right, so now we're done making babies.
Hooray.
And we are on to...
Now we're talking about my favorite topic,
Yes.
which is midlife women's health. And by definition, for your listeners, that's the over 40 crowd, 40 and above.
Okay.
And there's a journey in midlife, starting in our 40s, that we call perimenopause.
Okay.
And nobody seems to know what that is. So let me tell your listeners now.
Yes, because I don't. I'm like, Perry, what?
Perimenopause is the journey to menopause. So perimenopausal women are usually in their 40s somewhere, and their cycles begin to change. So they go from whatever they were to whatever they are now. Maybe they're shorter, maybe they're longer, maybe they're lighter, maybe they're heavier. That's the first sign that you know that the conversation between your brain and your ovaries, which has been happening so nicely for most of your reproductive life, is changing.
Okay.
And I like to think of the perimenopausal ovaries either being a little deaf or a little rogue. You pick it, how you feel about your ovaries, but it's just not listening to the signals the brain is sending out. So your cycles start to change. That's number one.
Meaning like days or...
If you were a 28-day cycler, maybe you're 21 days now. Maybe you're 32 days now. If you were a heavy bleeder, maybe you're a lighter bleeder. Things will change because that conversation has changed.
Okay.
And that throws the 40-something crowd usually into a hormonally chaotic space, very roller coastery in terms of hormones. So today your estrogen is high, and tomorrow it's low, and the third day it's just right. You're just all over the place. And that will... a lot of women will experience symptoms as a result of that hormonal roller coaster ride, like hot flashes and night sweats and mood changes and brain fog and weight gain and feeling crummy and feeling crazy. The list really just goes on. And all the 40-something.
So much to look forward to.
I know. I don't want you to be disheartened.
Do you see my face all the time? I'm like, what?
There's hope and there's help, but everybody needs to be aware of it. I'm always surprised when smart 40-somethings don't know one single thing about perimenopause. And the reason is you don't get one single lecture in your OBGYN's office.
That's true.
And so here comes a wonderful teaching pearl for your listeners. At some certain point, once you're done making babies, it may be time to graduate from your beloved obstetrician's office because their focus is on the younger reproductive aged woman.
Okay.
And you really should maybe find someone who is really focused on midlife women's health, because so many women say to me, I can't believe my OB didn't tell me anything. Quite frankly, they're really more interested in the younger group and their labor and delivery and getting babies delivered healthily. And your hot flashes are not their primary concern.
Right.
So that's a good point. And just to be clear, perimenopause can last 4 to 8 years. So buckle in for that because it is really a roller coaster ride. And at the end of that journey, you land at menopause. And by definition, that's when you have your very last menstrual period.
It's like you graduate, but my mom obviously went through menopause. She's 67.
Hooray for her! Hooray for you!
She graduated. But her and my dad get this implant into their butt, and it delivers the right amount of hormones that they're missing throughout the year, which is why they're not really saggy. And she was explaining something about that. She didn't have as much of the hot flashes because she was doing this stuff. So is there things we can do to prevent the horrificness of what we hear?
Well, I want everyone to actually think way more positively about this whole journey. Once we know what it is, we know why don't we feel well, what can we do about it? So the perimenopausal crowd is different than the menopausal crowd. So the perimenopausal crowd still is making estrogen, right? Did everybody listen at the beginning of my lecture?
Yes. Estrogen, perimenopause.
You're still making estrogen, progesterone, and testosterone.
So you can still get pregnant during this time.
And that's a very important point. So you still need to use contraception during this journey. It's pretty hard to get pregnant, but not impossible. So that's a very important point that you've just made. Thank you. So for that group of women who are not feeling well, hormone therapy, which is what you just alluded to that your mama used, is really not for this crowd. This crowd is too young. They're perimenopausal. They're still making hormones. There are other strategies for them. Okay. And here comes a news flash for these perimenopausal symptomatic women. A continuous low-dose birth control pill. If you are over 40 and you're not a smoker, if you use a birth control pill differently than you did as a youngster, if you use it continuously, there's no break. There's no placebo week off like we did when we took it as younger women.
Like the sugar pills?
Right. You don't take the sugar pills. You just take active pills every day of the week, every day of the month, every day of the year. That will take you off your roller coaster ride, hormonally speaking, onto the nice, even tram ride. And that will help you sail right through your symptomatic perimenopausal years. So you get contraception.
Okay.
And you get relief of your many symptoms that women experience. And you can use that strategy. There's no controversy there as long as you're not a smoker.
Okay.
And there are some other reasons why women can't take birth control pills, but mostly all of us can. And we take that journey up until we're 55 years old. 55, why would we choose that? Because the average age of menopause is 51. So some of us are not menopausal at 51. That's the average age. Some of us are still showing off and still have ovarian function after that. So we just journey everybody till 55.
Let me ask a quick question about the perimenopause.
It's a tongue twister. Say that 3 times
Perimenopause. Okay. So let's say somebody's married. Okay.
Yes.
They're done having kids. They're in their 40s now. Let's say they just turned 40. They're like, we're done. The husband's had a vasectomy.
Yes.
Should they still be on birth control for those symptoms, even though there's no risk because the husband's been cut?
So what you're saying is they're not concerned about getting pregnant, and thank goodness he's taken some responsibility for that. I love when men take a little responsibility for that.
I think it should be a rule.
But we use birth control pills for lots of other reasons besides contraception. So absolutely they're candidates for it having nothing to do with contraception? Yes, the answer is
Okay.
yes. And it's always perplexing. Women will say, well, I took birth control pills when I was in my 20s and I gained weight and I didn't like them and no, I don't want to take them. But really all women should know you should try that strategy. It's so easy to try and you'll feel a lot better even in a short period of 3 months or maybe even sooner. So you can try and see how you feel. Not every pill is the same. So that's where you get into finding a knowledgeable healthcare professional who can sort you out and figure out which one you might do better on versus another one.
So how do you figure that out? So I'm somebody who's never really been on birth control. I've always kind of had safe sex. And I've thought about doing it just to kind of relieve some of the PMDD symptoms that I can have sometimes. But it's how do you find the right one?
So there are
Without messing up your body.
Well, you're not messing up your body at all, and
Okay.
there are nuances to the pill. They all have the same estrogen, but when I hear of a woman, just like what you said to me, I have PMDD or PMS symptoms, it makes me think of one particular pill versus another based on the progesterone. Those are different, and the doses are different. So depending on what you tell me, I have PMS, I have PMDD, I have acne.
Like I get sad. I get
That's
and I
right.
feel very my confidence really drops. Like
Yes.
almost the depression kind of sits in. It's kind of like, but it's right before the period and then 2 days after the period.
You would be a perfect candidate. You would be a perfect candidate for a low-dose pill. I don't want to promote the particular one, but after the show, I'll tell you which one I would recommend for you.
Good. I think I need it.
You did mention something that's so interesting. Women who have PMS symptoms feel sad or blue. Women who have babies and then have postpartum depression. This group of women are really at risk for mood symptoms during perimenopause especially. So when they start their journey, when their ovaries start to aim toward retirement, all of a sudden they're going to feel a lot bluer, a lot sadder, really. So now you already know you have a risk factor for this mood symptomatology when you start your journey through perimenopause. You can identify this group of women early. Lots of women feel this experience. It has to do with that hormonal roller coaster ride.
So I would benefit from being on something that you'll mention off air to me.
Yes,
Okay.
and you'll start tomorrow.
And you guys can email me and I'll let you know.
And you'll be so much happier on your show because you'll just be
right.
nice and even and smooth sailing.
I know. I feel really happy now, but like, oh my gosh, coming off those hormone drugs and the egg freezing. Oh God, that was an adventure, right? My dad said, "Well, at least they're out of you. Now you can just get rich and put them in somebody else." I said, "Yeah, I might have to do that." That was like quite an adventure. But no, that's good to know. So if I did start on a low dose estrogen, you said?
A low-dose birth control pill. So
okay.
birth control pills have both estrogen and progesterone in them.
Okay, so you start with the low dose.
Yep.
And then when I want to get pregnant, if I decide to carry my own
Yep, you stop your birth control pill.
that day,
Simple as that.
and then you get back on it.
Well, if you want to get pregnant, there's a whole journey there for you, sister. So we can talk.
My eggs are on Fifth Avenue. My future children are in a freezer on Fifth.
That's a longer, more complicated journey. But the short answer is yes, you would stop your birth control pill and your infertility doctor would help you get pregnant. Okay. And then you would have a bouncing baby and you'd be sleep deprived and miserable like all the rest of us.
My gosh, I'm so excited for the future. Holy crap. No, that's amazing. But I'm happy that we brought that up because as I've gotten to become more aware of the symptoms that I have during this time and trying to figure out, okay, because at first I just thought, well, maybe I should go see a therapist because that was my first thing. Well, I'm sad because I'm not this or I'm not that. And then when I realized I would go to therapy and it would be a totally different conversation sometimes. And she was like, I don't know how much childhood trauma you actually have. I think it could be hormonally related to realize that this wasn't anything a therapist could fix.
So that's a really good point. So many women experience mood symptoms, especially, again, as we transition through perimenopause. So if you land in a gynecologist's office, you're more than likely going to be treated appropriately for perimenopausal symptoms. And if you land, let's say, in a primary care doctor's office, you're more than likely going to be offered an antidepressant. So there's a different strategy. I would rather you land in my office and let me help you with a low-dose birth control pill, which will put you on an even keel.
Versus...
And after 3 months, we'll see, do you really even have a real depression or was it just hormonally based? And for so many women, it's just hormonally based.
I'm going to be in your office next week.
Okay. I'll see you next Tuesday.
No pun intended. You're funny. I like it. All right. This girl's got some sass. We are ready. Here we go. Now we're starting the podcast. No, I love that. So how did you get into this whole thing?
Well, I always wanted to be a doctor, and
Okay.
I figured out I wanted to be in women's health care. So I chose obstetrics and gynecology.
Okay.
I trained, and I think I delivered about 1 million babies, who's counting.
Right.
But somewhere in my middle 30s, I just really gravitated to the over 40 set. They were really struggling with symptoms and issues, and nobody was helping them. So I just woke up one day and decided I am no longer going to deliver any more babies. I am going to focus on the midlife women's crowd over 40 until death do us part. And that's it in one day.
for you.
I just made that decision. And really, I've been doing this now for more than 25 years, and it is the most fun job in the world.
Because you're kind of helping women through something that your body's changing. You don't know what's going on. It sucks because nobody understands. But let's talk about that a little more. Like how you strike me as a very confident, sure of yourself. You're a hot mama. You're a MILF because you're your mom. Everyone knows what that means. We don't need to describe it. How do you stay confident when your body's going through all these changes? Because here's the thing. Like, the men get older, the women get younger, right? The women get older, and it's like all of a sudden our options become less. What is with this? I don't like that. How do we stay vibrant?
Well, first of all, we all, at the tender age of 40 and above, we really have to start paying attention to our lifestyle choices, right? We've gotten
Yes.
away with not eating healthily and maybe not exercising before that.
Yep.
But once you join the perimenopause club and you don't feel well, you really have to start listening to all of those lectures about eating more fruits and vegetables, eating less of everything we know we're supposed to eat less of,
Yeah.
exercising every day or being active. That's the secret sauce, frankly, for weight maintenance and weight loss, which really plagues women as we get into our 40s and beyond. And we redistribute our weight to our middles, and nothing is fitting, which makes us more irritable and
Yeah.
moody about. So lifestyle changes, ladies. Now, I know you don't feel well, but you're really going to have to start putting one foot in front of the other. And I always say you have to start putting yourself on your to-do list, right? We've taken care of children and our careers and our parents and our everything. And now perimenopause is your wake-up call to start making the choices that you need to make. And so that's really the first thing you have to do. And I also really stress the importance of protecting your sleep. You really have to be rigid as you can, where you have to have sleep habits that are impeccable. You really do have to go to bed at the same time every night. You really cannot binge watch television like all you young people do today.
Right.
So what you have to start with lifestyle changes. If you're a smoker, you have to stop smoking.
Yeah.
These are all the changes that have to be done in your 40s if you expect to feel well and live a longer and healthier life.
Gotcha. Okay. So 40s is kind of
40s is your wake-up
shit
call,
or
ladies.
get off the pot in a weird sort of way, right?
I think in a weird, wonderful way. Finally, you have permission to put yourself on your to-do list, right? You have been putting you off for a few decades, and now you're going to really focus on you.
Well, here's the thing, though, is now that more women are becoming career women, everything's kind of, the whole timeline has been pushed back. So now you've got more women in their 40s becoming moms. So now you're doing perimenopausal
Yes.
and children at the exact same time.
Well, I at the tender age of 40, I had my first child, and then my second one came 41 and a half. Bam, bam, blam, bam, thank you, ma'am.
There you go.
And then I've joined the perimenopausal club at 45. So really, it's a treacherous time for women. You have little children, and you're personally symptomatic and feeling lousy. And women say to me, I really can't have good sleep habits. I have babies to feed, and they're up all night, and I don't feel well, and I can't exercise. There's no time for that. And I hear all of you, and I understand. And so that's why you make small changes when you can, knowing that there is a process and a journey, and you will feel better and you will get better. You really just have to find a great partner, great information, what you're supposed to do, and a great healthcare professional to help you get there.
Okay, gotcha. And so, let's talk about your book.
Yes. Let's talk about my masterpiece.
Yes. What was your motivation to write Menopause Confidential?
Well, I was minding my own business right before my 50th birthday, and a literary agent saw me on the Dr. Oz show talking about perimenopause, and she contacted me and she said, I think you should write a book. Now, for all of you ladies listening, that's about the last thing you want to do when you're turning 50 and exhausted and raising teenagers.
Right.
But I thought, oh, okay, why not? I'll write a book. And that's what I did. I sat down at my kitchen counter. It took me 9 months, which is very poetic for an obstetrician to do in 9 months. There's my baby.
No pun intended, right?
And I just wrote a book. Every Wednesday, I just sat down and thought, what would I like to tell? What do I tell my patients? What chapter should we talk about today? What do women need to know? And a book came out of me.
Okay, so let's talk about some of the stuff that is in the book. So you kind of go through. Okay, so let's talk about this chapter. It's the first thing that came out to me. Chapter 3. My husband thinks I'm crazy.
Yes, that's all about the mood changes during perimenopause and menopause. And the title came from a patient who walked into my office and said, my husband thinks I'm crazy. But I say to all women, you don't need to have a husband. Your partner, your children, your coworkers, you yourself feel crazy and you don't know why. Yeah. And it's because you are entering this wonderful, chaotic world of perimenopause. And that's usually the reason. Of course, you have to make sure that you don't have other issues, thyroid disease, and real clinical depression, real anxiety disorders. But for the majority of women, it is the journey through perimenopause that makes them feel crazy.
Interesting. Okay. So sometimes people might think like, oh, I'm just hormonal but they really could be going through something that's
Yes, you can
specific.
You can have something really real and needing different medications, but women need to know, we need to normalize that you're not going to feel great. You're going to feel more anxious or maybe panicky or maybe angry or impatient or snip-snappy. Yeah. All of these things are part of that journey and you don't know why and you do feel terrible. And when you find out that it really is just your hormones changing, it's like having an Oprah aha moment. Okay, I'm not really crazy.
It's not me.
I'm just perimenopausal.
Right, you're like, it's not my issues. I got no daddy issues. I got hormone issues. All right, chapter 6. The vagina is like Las Vegas, baby.
Yes.
Explain.
Yes, that is one of my favorite things to tell women. Vaginal health is so important as we journey in our 40s and 50s, but nobody tells you anything about your vagina or what you're supposed to do with your vagina to maintain a healthy vagina.
I'm sorry.
So what happens?
Our sound guy's going, wow, here's a lot of vagina. A lot of vagina.
So there's honestly a lot to know, and your gynecologist doesn't have a lot of time to tell you everything you need to know about this particular topic. So if you're experiencing dryness or irritation or burning, and you will, 100% of women will experience vaginal dryness and vaginal atrophy once their ovaries retire and we're not making estrogen anymore. This is inevitable for all of us. So you really need to know how to maintain vaginal health. And the punchline of why the vagina is like Las Vegas is because vis-a-vis local vaginal estrogen. You put estrogen into the vagina. What goes in the vagina stays in the vagina, very much like Las Vegas. And it really is the gold standard for the treatment of vaginal dryness in menopause.
I almost spit my water out. That's hilarious.
I do have a homework assignment, though. I hope your listeners don't mind my using big fancy words. But I want to tell all your listeners that everybody, who, especially if you don't have a partner, really needs to do their weekly homework assignment of masturbation. Yes, I just said that out loud. I hope I'm allowed to.
I have to tell a story. My aunt's going to kill me. Okay, so my aunt her gynecologist, she had her vagina reconstructed. So she's like, I have the vagina. I actually have the recording. She said, I have the vagina of a 17-year-old because it's never really been used. Now she's with a guy who's sick and doesn't matter. But her vagina is not getting used. And she said, my gynecologist told me now an active vagina is a healthy vagina. Yeah. So she told her, go to Fascinations, which is a sex shop in Denver, get some dildos and some vibrators and go to town. And she said, what am I supposed to do? Lay in bed with my vibrator going when my husband's snoring next to me? And she said, yeah, But it's true.
Well, it honestly is true. So it really is not necessarily about libido. It is about vaginal health and bringing blood flow to the vagina and keeping your vagina juicy. And this is a free, easy way to do that. And vibrators are terrific and very helpful for women. And women.
So you don't need to go into the vagina. You just need to orgasm in the.
You don't even have to orgasm. So that's it's harder to have an orgasm once your ovaries have retired and you're no longer making estrogen, progesterone, and testosterone. It's harder to have an orgasm. They're just not as strong and wonderful as they were. Many women say, oh my God, all this work for that? I'd rather just watch a television show and go to bed early. But it's so very important to stimulate the vagina. A vibrator is very helpful to do that. And actually, you should insert the vibrator into the vagina because that maintains the caliber of the vagina. So in case you do have a partner whose bits and pieces work and you want to use him for your vaginal health, that's what I always say. Use your partner for your own health, vaginal health.
Right.
So either
a dildo with a pulse.
But girlfriends can do it for themselves. Once a week, I hope everybody heard their homework assignment.
Okay, so you should masturbate once a week.
Yes, you can have, if you want extra credit, you can do more than once a week. But once a week is plenty for improvement of vaginal health and bladder health.
Is there an issue with excessive masturbation?
There is no issue whatsoever, except I guess you have extra time on your hands. I don't know anybody who has extra time on their hands.
Wait, this is hilarious. Okay, so everybody masturbate.
Yes, and get your vibrators, ladies.
Yeah.
You can go on Amazon.
What's your favorite vibrator?
I don't have a favorite.
Okay.
You just find the one with the good reviews.
Okay. The what's the one that's very expensive? It's the Aura. It's supposed to be like a oral sex simulator.
Yeah,
this is the best.
You don't.
I love that we're talking about this.
Yeah, you don't really need to go. You don't need the most expensive one, and just get one, a nice basic one.
They sell them at CVS now.
Well, then off to CVS you go.
That's okay. So I guess I love it.
You got work to do.
I did work last night. No pun intended. Okay. No, because I remember I kind of said, I'm going to give up sex because I'm not getting what I want from it, right? Like power of the vagina, so to say. But that didn't really serve me.
No, it really isn't. So really, if you want to do, more than once a week, you have permission to do whatever it is you have time for, sister.
Right. This is true. Okay. All right. I'm not going to ask about personal stuff, but but what if you're married? Do you still engage in that activity?
Yeah. So what I say to women is, if you have a partner and you love your partner and all your partner's bits and pieces work, you can use your partner for your health and wellness. And if you want to do your homework assignment additionally, you can do that too.
Okay, gotcha. And how often should a man ejaculate then?
I have no idea.
And who cares right now?
But by the way, I do have a chapter in my book called Every Man Needs a Gynecologist. And so I really feel like it's required reading for men as well to learn a little bit about this topic, especially if they want to be a more caring, loving partner and understand what their sweetheart is going through in their 40s and 50s so that they can be, again, just have a little bit of knowledge would be very, very helpful, all the men listeners today. So Menopause Confidential is for you too.
No, it's absolutely important, especially if you want to be a supportive husband and you want to understand what's going on and not to say, okay, my wife just hates me.
Yes.
Your wife probably doesn't hate you. She just cannot control what is happening. And what is causing these hot flashes? That's the one thing everybody's familiar with is if you say menopause, everybody thinks hot flashes.
Well, hot flashes are the most common symptom in menopause. 80% of women will experience them. On average for 7 years. Some women will experience them for up to 20 years. And nobody really knows the mechanism of a hot flash. There's a center in the brain called the hypothalamus. It originates there. But what happens to women is our thermoneutral zone, our thermostats, narrow. What that means in English is that when you used to go into a room, you could be comfortable in a range of temperatures. But when you get older and are getting closer to menopause, you are less comfortable in that range. And when you walk into a warmer room, immediately, if you feel warmer, that will trigger a hot flash for you. And if it's really severe, you might start sweating and you might start feeling panicky. And so again, for all women, you can't really die of a hot flash, but hot flashes are linked to heart health and depression. So if you have significant hot flashes, you really do want to see an expert in midlife women's health to find out what strategies can be helpful for you to reduce or improve those symptoms. That's a really big deal, hot flashes. I know we joke about it and we laugh about it, and all women are dressing in layers, and then you take off your clothes because you're so sweaty and hot. But really, there are wonderful strategies to help you so that you can not be interrupted during your work, during your important meeting, during anything. You want to be comfortable, and you certainly want to sleep all night. You don't want to have to get out of bed because you've had a hot flash and you're sweating, and now you've got to change your sheets and your nightie. Right? It's a big deal. Right. It's a big deal, hot flashes.
So how does somebody deal with the hot flashes and minimize them?
Well, there are natural strategies. Of course, all women, any hot flashers in the audience, we all know you got to dress in layers and cotton and drink cool fluids. Keep that AC on. Keep your fan on. But the gold standard in menopause for treating hot flashes is estrogen therapy, hormone therapy, and that's
Which is like what my parents have with their butt pellets.
It's adorable that your parents are doing it together. Is your dad hot flashing too?
No, I don't want to know why he's doing it, but I think it's because my mom has a homework assignment. I'm going to leave it at that.
Okay. So
hey, they're still happy.
That's a pretty big topic, hormone therapy. It is for symptomatic menopausal women, and there's ways to get your hormone therapy. So it's patches or pills or creams or gels. And there are bioidentical and other. It's a big, complicated topic, but I cover it in the chapter called Potions, Patches, and Pills. Oh my! To help sort you out. What's the best choice? What's the safest choice? What's the right dose? You really need, again, to partner with somebody smart.
This is like the Bible.
Yes, I cover everything, sister. There's no stone left unturned.
So I heard about this cream. I may be butchering the name. Maybe it's called Esty.
Well, there's estrase cream.
Maybe that's what it is.
That's a local vaginal estrogen cream for dried up vaginas.
Okay, so somebody was talking about that at Christmas.
What a wonderful topic to talk about.
Yeah, we don't talk about when's anybody getting married. We're like, when's the last time somebody had an orgasm? It's my family. But they were talking about this cream.
Yeah.
And my aunt said, the one that needs to exercise more or do her homework more, she started using it, and she goes, I walked down the block, and I'm like, whoo!
Yeah. It's very significant and it's actually it's no joke. Okay. When you experience vaginal dryness and atrophy, it is a terrible, terrible symptom, and it's absolutely preventable or reversible. So God bless your aunt for having an excellent healthcare professional who knew what the right strategy was for her.
Yes. Okay, so is that a newer cream?
It's been around for a while. Again, there are creams and there are tablets you can put in the vagina or ovules. You can try natural strategies for women who don't want to use a local vaginal estrogen. So you can try something as easy as olive oil. Oh, yes, you can. You have it in your cupboard. It's a very normal, natural moisturizer for vaginal tissue. But not every oil, ladies. I'm always asked, can I use coconut oil or almond oil or vitamin E oil or anything that says oil? No. But absolutely you can use olive oil, and you don't have to buy an expensive one for this purpose.
So you can use it as lube?
You can use it as lube, and it's an excellent moisturizer, more specifically. And moisturizers are different than lubricants. I'm glad you brought that up. Moisturizers you do a couple of times a week, like you might moisturize your face every single day.
Yes.
Lubricants you use for the insertion of something into your vagina. So is it a vibrator? Is it a penis? Whatever you're putting in there, sisters, lubricants will help get it in there. So lubricants help things become slippery.
Right.
And so there's the difference. So when you go to the store, figure out what you're looking for. Are you looking for a moisturizer? Are you looking for a lubricant? Are you looking for both? Make sure you know what you're looking for so you get the right thing.
So does a moisturizer still help it slide in, or is it?
Again, for women, it really helps the tissues become more moist, but not slippery. So you want to slide something in, you want something a little slippery.
Okay.
Slippery when wet. The
moisture. I guess we don't get as wet. We don't get as excited when we're in the menopause phase or the perimenopause phase.
I want all your listeners to know that sex can be great. It will be different. It will be different, but it can be great and comfortable.
Well, I also heard that women in the 40s go into what men call the filthy 40s.
They do?
Yeah, where they're just like, anything that was off limits before is all of a sudden go.
Well, that may be true, and that may be because they're freed up from all the stuff they were busy doing in their 20s and 30s, I guess, in terms of, and now maybe they're feeling a little freer with who they are. I'm not sure there's anything hormonally related to that experience.
Right. All of a sudden they're like, well, when I was in my 30s, I went to church, and now I'm hit 40 and I'm S&M.
Great. That's actually, that could be an aerobic exercise, which is very important for heart health.
Oh my goodness. So the other thing too is the big thing is sagging skin, which is everyone's worst fear.
Yes.
And that tends to happen when estrogen.
Yes,
drops.
I don't think that's everyone's worst fear, but it is absolutely a concern for midlife women. I can think of worse things to be frightened of.
Wait,
but
you're right. This is true.
I do have a chapter called Who's That Wrinkly Old Woman in the Mirror? Because you wake up at some point and you look in the mirror and you look at your face, and all of a sudden you start to see wrinkles and sagging that you really didn't notice before. And it's such a surprise to women. What has happened to the youthful me that I used to look back at me at the mirror? And again, estrogen, I told you, really fluffs everything up, including your healthy skin. So when your ovaries start to make less and ultimately no estrogen, you lose the protection for skin health. So, of course, everyone already knows this, but if you haven't already been putting on your sunscreen,
yes,
365 days a year. Sunscreen is not just for summer anymore.
Oh, I'm big on that, girl.
Right, and you got to stay out of the sun, and you got to wear your big hat, and you got to throw out all your V-neck shirts. That's a place where women don't remember or realize that you get so much skin damage to the décolleté.
Yes, I'm about to do Fraxel, because my chest doesn't even look like my face.
So now you're going to start wearing muumuus and kaftans and long sleeves.
And I'm going to start masturbating a lot more because nobody's going to want to take me home.
Well, you'll have the most beautiful skin. So you really have to do some protective measures, of course, for wrinkling and dryness, and also to prevent cancer of the skin. That's such an important topic that your listeners don't want to hear about, but that's one of the many reasons why you're going to start to be more mindful of skin health.
Well, I do now put SPF on my chest every day too. So
Perfect.
It's like here down, and I've noticed that the damage has gotten less.
Yes, and you'll stay out of the sun, and you won't. And I was just traveling in a warm climate, and I was the only tourist who had my umbrella, my little rain umbrella, but it was sunshiny, and I used it specifically to keep me out of the sun. So let them all laugh out loud.
Well, you see a lot of Asian women in New York do it, but then you look at their faces and you're going, yeah, they're smart.
We should, ladies, if you learn nothing, bring your little rain umbrellas everywhere you go in the sun and open them up proudly.
I think it's great. I'm surprised. Do they have UV umbrellas yet?
I don't know the answer, but there's, for any entrepreneurs in your listening audience, there's an idea.
UV umbrellas, right? They got UV shirts, UV swimsuits. That is true. So what can we do so as the estrogen naturally starts to drop, that's where the hormone...
That's where you're going to see your that's where you're going to see your skin start to suffer. So, of course, you're going to moisturize and stay out of the sun. And when you're officially in the menopause club, you no longer have menstrual periods, you're going to really see a change in skin health. So for those of you who are interested in skin health and are symptomatic in menopause, hormone therapy is also an excellent choice to improve not only symptoms, but you'll also get the benefits of skin health, which is not a vain thing to want. Women always say, I'm sorry that I'm so vain, but I don't want to. It has nothing to do with that. Skin health is really, really important, and we shouldn't feel badly about wanting beautiful skin.
Absolutely. So let's talk about, because some people might be listening going, well, what is hormone supplements or therapy? What are we talking about? What is the process? Where do I go?
Well, first of all, you're going to find a healthcare professional who was very well versed in midlife women's health. And that's not everybody. So you'll have to do a little vetting.
Okay.
I like to send women to an excellent website called menopause.org.
Menopause. Okay.
It's the North American Menopause Society. So whatever town you live in, you can put in your zip code, put in the name of your town, and out will pop specialists who really know what they're doing in this realm. Hormone therapy is just getting a tiny little drop, basically, of estrogen, and if you have a uterus, also progesterone, and some women also need a little bit of testosterone. So it's getting a little bit back into your body. It really is nothing compared to what your ovaries made. Your ovaries made oceans of estrogen, progesterone, and testosterone. And when you use hormone therapy, you're really just getting a tiny drop back in that ocean. But it's enough for your brain to help with hot flashes and night sweats and mood and all your health from head to toe, frankly.
So is this a shot you do once every 6 months, once a year, or what is it?
There are different approaches.
Okay.
There are pills, there are creams, there are patches, there are rings.
What are the pellets that are in my parents' butts?
So what your mom is using is an off-label, non-FDA approved strategy. That's a very old-time strategy that gives you a great big burst of estrogen. It's a pellet that has been inserted under the skin.
Yes.
And it lasts for a few months, and then you get your next, or it's either 3 or 6 months. But that is actually not the best and safest strategy. So I would really caution all your listeners to choose FDA-approved products that have been tested so we know their efficacy and safety. So your mom is from a generation where that's what was used for them. But really, I liken it sometimes to a cassette tape versus an 8-track tape versus the CD. And now I know kids listen to music somehow through the air. I don't know how that works. But as we get older and smarter, the delivery system and the choices for women get safer and better. So you obviously want to go with the best available, latest approach to hormone therapy.
What do you think is the best?
There is no one size fits all for women, and that's when you have a nice chat with your healthcare professional. So if you don't have any health issues, heart disease, or any major issue, you probably have all those choices at your disposal. So it really depends. I like the transdermal approach. It's not a tablet. Just because women, it's a patch, but it really gets you your estrogen right away. So it goes right from your skin into your bloodstream and right up to your brain in a moment. I like that approach for a lot of really symptomatic women, but there's also a pill. A lot of women don't want to have a patch, and now you can see their patch. So they would rather take a pill. There are choices for everybody, really.
Okay. And is this something, the patch is a new patch every day? Like a pill once a day?
The pill is once a day.
Okay.
The patch is a twice weekly. Usually that's the best approach. There's also a once weekly. You can stick a ring in your vagina for 3 months. That'll work. There's a lot of stuff here for us to unpack. I don't know if your listeners are ready for all this.
No, I love it. So, I mean, I kind of feel bad for my grandmother. They didn't really have any of this stuff.
Yes, then we learned from women like your grandmother. So what happened to your grandmothers? Nobody had a chat about menopause. Lots of women suffered. And there's a really big, important health issue we haven't touched on, and that's osteoporosis. So we watched all our grandmothers shrink and curve over. And the osteoporosis is a preventable disease, and it really kicks in after menopause when we don't have that estrogen. Our ovaries were used to help protect bone health. So it's a really big issue for women that nobody really talks about. And it's a silent disease. You don't know you even have it until you break a bone or fracture your hip. That's a terrible, deadly fracture to get. So we have to thank all the grandmothers for we saw what happened to their bodies, and we learned from their bodies, and we made some changes for the next generation and the next generation.
It's just, I mean, it's crazy. But so what do you think is... like, let's talk about somebody like Christy Brinkley, right? She's what, 67, 68 years old?
Yes.
What is she doing?
She has sprinkled magical fairy dust all over her. I would like to know what she's doing too.
Does that have anything to do with, like, what's that stuff I hear on, sometimes you see it on the commercials, HGH? It's like a hormone human growth.
Well, I hope she's not. I hope she's not using that, because that's not FDA approved for the treatment of anything in
How
women.
are they able to advertise it and sell it at the drugstore?
So here's what you learn the hard way is they can do anything that they want in health food stores, and whatever the marketing package says, safe for you, healthy for you, and will cure anything that ails you. You really have to be very smart when you're making choices about what you're going to take for your very specific issues. I can't really say enough that you don't really want to stray into the dark side of, products that really have no basis in science.
Okay.
Don't waste your money there. I would like Christy Brinkley to tell us all what she's doing, because whatever she's having, I'll have that.
I know, because you look at her and you're like, is this for? I mean, obviously, she's talked about she's done some natural injections, but it's all about the natural stuff. But so you're saying that you should do the patches or the pills or whatever form you decide to do throughout menopause. But how do you know when it ends?
Yeah, menopause never ends. So the question really is, do I take hormone therapy forever? Do I take it for a year? Do I take it for 7 years? Everybody has a different risk for a different issue. So that's where there's no one size fits all. There's no right answer to your question. Some women stay on it till death do us part, and some women just use it for a few years. It really depends on what our goals are for you, and that's really where a great conversation with an expert is going to be your very best friend.
So are the hormones more than for kind of your physical symptoms?
Yes.
Versus your...
Yes, it's for quality of life issues. So for sleep and for mood and for cognition and for hair health and skin health and vision health and colon health and all your healths. And the only one thing that I really think women fear, and they fear it most of all, is breast cancer. So when you talk about hormone therapy, women are concerned, will I get breast cancer? That's a really big conversation. But the risk of breast cancer is so tiny compared to the benefits of hormone therapy in the right symptomatic group. So it's not for everyone, but it's for a lot of everyone's. And this is, again, it's a pretty big topic. I cover breast health in the chapter called It's All About the Breast to help you really understand mammography guidelines, which have changed. Every chapter really deals with a different thing, but I want women to not be fearful. I don't want you to come to the perimenopause or menopause party clueless. I want you to get your information before you get there so you really understand the journey and what your options are, so you're not fearful and you're not confused and you're not frightened.
Right, because it's overwhelming. It's like one thing after another. I'm coming back with a penis if I have to come back.
Well, I think we're the best
we are.
sex of them all, and
I think so too. But we have the most work.
Well,
do men don't go through this crap?
I don't know one single thing about men, but I will tell all your listeners that really this is the best time of your life. I really mean that. When you start making your healthy lifestyle choices, really taking care of yourself, you're really freed up now. You got about 30 years left or so. Tick-tock on your clock. Let's start doing some stuff that we really want to do, right? And
that's true.
It's a very freeing, wonderful, wonderful time of life.
You know what? You're right, and it's all about how you look at it, right? You can look at it like
it's not about how you look; it's how you look at it
and how you feel.
Yes, 100%.
I think it's more about how you feel than anything, right?
100%.
Because we've had conversations with friends. I've had it with Lynette. It's like you go back to 25 if you could go back with what you know now. But it's like I don't want to be 25 again. No way.
I would never want to go back to 25. Never.
No.
I like to say 50 is the new 50, and 60 is the new 60, and 70 is the new 70, and 80 is the new 80. But 90 is still the same old 90. That's just the way it is. But really, it's really
then you're really old. You know what I'm saying?
It's really the greatest time. Really, I want all your listeners to know that it's true, and that just start making really great choices for yourself, and you'll absolutely feel that way too.
Well, life's a journey, right?
It's
about the journey, not the destination.
Correct.
So, but no, I hope obviously, I'm not in the menopause.
But when you are
menopause phase,
you'll get there.
Menopause. But now I'm prepared,
and I want you to be excited about it.
And I'm excited for you to see my vagina next week.
Okay, then.
But in the doctor's. She's like, all right, you will be the second guest that has seen my vagina.
You're being naughty now.
I know. Now I just got to go home and masturbate and do my homework.
Excellent. Good.
So where can we find your book?
Well, I think you can, if there's a bookstore near you or a library. I have many readers who've gone to the library, but of course you can get it online anywhere. Menopause Confidential. I'm sure the nice people from Amazon will be happy to bring you one.
Okay, perfect. So Menopause Confidential, and your website, tell them?
Is drallmen.com. And I just like, my last name is Allmen. Isn't that funny? Allmen. I take care of all women, but my name is Allmen.
Oh, my God.
That's funny right there.
That is hilarious. I just love you. You said, see you next Tuesday. You told me to masturbate consistently.
I did tell you that.
And your last name is Allmen. I love this girl. We got to have you back on the show.
Okay.
We're going to have you back on the show.
All right.
After I do my experiment with birth control.
Okay.
To see how I feel. So
yes.
I have less PMS.
Yes.
I got to find myself a husband. So, you know what I'm saying?
Good luck with that.
You
I can have mine.
I think I should, at this point, I'm like, I should just get a really expensive vibrator and call it a day, right? And just take myself out to dinner. It'll be good to go. Well, I'm so excited that and thankful that you were here. Is there anything you want to leave us with before we depart?
Yeah, before we depart or before we part?
Yeah, depart. Yeah.
I want all your listeners to feel excited and hopeful about midlife. Really, it is. That's really my final word. It's the greatest time of your life. Enjoy it. Okay.
Well, let's all get excited to get older. I like that, though.
Great.
Right? It's your life. It's your choice. I love it. So thank you so much. Again, you guys, Dr. Tara Allmen. You can find her at drallmen.com, and her book, which you can get online or at a local bookstore, Menopause Confidential. And thank you all for listening to another episode of Next to Madison. We'll see you guys next time to find out who's next. Hi, your host, Madison Malloy here. I just wanted to remind you guys to please follow the show on social media at Next to Madison. And if you have any questions or suggestions for the show, or you feel that you would be a great guest on the show and would love to be considered, please feel free to email me at nexttomadison@gmail.com. Don't forget to subscribe to the show on all podcast platforms. And I thank you again for listening.